Hello, this video is to educate family or friends to apply overpressure to your exercise. I'm first going to go over extension mobilizations, and then I'm going to go over the press-ups with the overpressure. I only recommend that you perform this if you've been instructed by myself or by another trained mechanical diagnosis and therapy clinician. So the patient needs to be on the floor, and the helper needs to be on the left side of them. Don't do this on the bed, it's going to be way too soft, but since I have the luxury of a treatment table, I'm going to show it here. Let's see. I'm going to show you the lowest lumbar segment. That's just typically the most common, but you may have been instructed by me or your clinician to perform it at a different level, and that's not going to change the technique, it's just a different spot, and they'll guide you through that. First, what you're going to need to do is find the spinous process of the spine. That's that sticky outy bone. So I'm just burning my fingers, and this is how you find that. It's not that hard to find. There are different bones, but it does feel sometimes like one bone, but it's not. It's a bunch of different spinous processes that are going to run like that. But they get real close together, so it seems like it's one spine. So you're going to be using this, the helper is going to be using this part of their hands on both sides to do the pressure, okay? So again, I'm showing you the lowest segment, okay? So if you get too low, you're going to lose the sticky outy bone feel, and you're going to be on the sacrum. The person's going to be able to tell you, no, that's my sacrum, not my back. So find the lowest segment right about there. It's just around the belt line, or a little bit lower depending on where people wear their belts. The left hand is going to go just to the left of the sticky outy bone, and the right hand is going to go just to the right of the sticky outy bone. So it looks like that. And the wrists need to be extended, and your elbows need to be straight. If the wrists are not extended, it's way too hard to get the force. You'll be spreading apart, okay? And so your hands need to be as close together as you can get them. So it looks like that. The right hand is horizontal, and then the left hand is vertical. And so they should be oriented perpendicular. Okay, so once you have your hands placed, that's the hardest part. The next thing you're gonna do is just apply a downward force. And they need to try to be equal force. The patient's gonna be able to tell you if you're pushing too hard on the right or the left, so just let them give you some feedback. Start gentle. And as you keep going, you're gonna just increase your force. And these spines, if we're at this point in treatment, typically they need lots of force and it won't hurt the person. Worst feedback I get is it feels like you're squishing my guts. Otherwise, it tends to feel good. Now, if you are experiencing pain, the patient experiencing pain, they should be able to know what to do with that information. I should have been able to guide them through that before I sent this video. If it wasn't me that sent you to this video, you need to be talking to your clinician about pain during this procedure if you're getting any, and what to do about it. So the rhythm is important. This is not CPR. This is pressure on, pressure off, pressure on, pressure off. And I really am I'm putting my body weight through that. Okay? Okay, now I'm going to take you through press-ups with overpressure. So it's the same technique, and you're going to apply the force, but this time you're going to apply the force and maintain that while the patient presses up. And the only thing you need to make sure you do as the helper is to move with them as they extend their elbows all the way up, and then go back down. Again, the helper needs to be maintaining the pressure, and then they can release. So apply the pressure, and then go ahead and press up. And then I just move a little with her as she extends all the way, and then come back down and relax. Again, if you do different segments, it won't change a whole lot. You might just need to bend over a little further as they do it, and encourage the person to really extend their elbows and push through to you. All right? As always, you can text me if you have any questions.